spike chamber. This is where I'm going to spike my bag. This is my medication port. Okay, so I'm going to hang this up. This is also a macro drop chamber. This one here is a standard set. Doesn't have anything fancy on it. This is also 20 drops per ml.
So is that like a standard drop?
This is a standard one. This one's 81 inches in length. It has a Y set on it. I'm gonna go ahead and open it up as well. Take it out. Put all this stuff together. You always want to kind of keep your stuff for documentation reasons. This doesn't have to be in with your patient. This must have a lot of static electricity in it today. I'm going to take and I'm going to go ahead and straighten it out a little bit.
Get the kinks in.
Okay. Before I go to spike my bag, I'm going to go ahead and close it all the way. Otherwise, it's going to drip out really, really fast. So I want to close it so that it doesn't do that.
Oh, that's
wrong with it.
Roll.
Very simple.
You gotta roll it.
Yeah.
Keep rolling.
How you know it's closed?
If it's closed, if you roll it all the way down, it clamps it off. And then you also have the secondary lock right here. I'm going to go ahead and open that, but I'm going to leave this one closed because this one I want to be able to adjust. Okay, this is sterile, so once I take this off, I don't want to touch this part. I'm going to pull my,
No, it ain't.
pull that,
It ain't gonna.
and you're going to spike your bag. I'm actually going to move it back down here. This makes it a little easier. I want you guys to be able to see around me. Just going to put it in your bag and push it in.
Turn.
And now it's spiked. Alright, so now I'm going to squeeze it and I want to fill this chamber about halfway full.
No, she goes.
Okay?
So when you setting this up, are you doing it while you in the room with the patient?
No.
No.
This will be all set up before you go into your patient's room. Alright, this little blue cap keeps this end sterile as well. But we're going to take it off and just set it down right here in front of us. And you can use a trash can or a sink, or in my case I'm going to use a little emesis basin. And I'm just going to open it up and get all the air out. And notice how I'm doing it nice and slow. If you do it really, really fast, all you're going to do is pick up more air bubbles. So if you go slowly with it, and just kind of let it bleed through. So this is an area right in here in this Y area that tends to get air bubbles, so as you can see right here. So you want to kind of give it a good tap.
My little finger.
Turn it upside down.
It's coming on. It is.
Give it some more taps, and then feed that through. Again, slow and steady wins the race on this. Because if I did this super fast, I would be picking up more air bubbles and it would take twice as long to tap all these air bubbles out. Now I've got all my air bubbles out of there. They're all out of here. Now I can put my cap back on here to keep it sterile. Okay, and usually we just take and swing it over there like that. And now we're ready to take that part into our patient's room. I've got my little caboodle here of my IV setup stuff. This is what I was talking about, that starter kit that has everything in it that you need but the needle. So this here is really nice to have. You don't need this if you have everything that you need. Tourniquet I have, right? Tape I have. Even more tape right here. Gauze if I need it. I have the little window dressings right here. No, that's gauze, but right here is the window dressings. So if I didn't have a kit, I can have all these separate. But when I bought these, they were on sale, so I got these cheaper than buying them separate. So we're going to use the kit today. Hi, Mr. Arm. I'm Lisa. I'm your MA today, and I'm going to be doing an IV today. Can I get you to finish saying your name and your date of birth for me? Yes.
10/02/1978.
Yeah, there you go. There you are. Are you allergic to anything like alcohol or betadine or anything?
I'm allergic to all of it.
I'm going to use the betadine iodine solution. Got my tape. I've got and another dressing right here. Okay, the only thing I'm missing my gloves and my needle.
Is it gonna hurt?
It might pinch a little, but it's, you know,
No, that's alright, little.
everybody's different, so you may have some pain more than other people. I don't know what your level of pain is.
Okay. I don't take pain well, but I'll be alright.
These right here are your non-butterfly type. There's no wings. This is just a straight needle.
Now.
Now, you wanted to know about the catheter. So when you take this off, this is a needle with the catheter.
It's
When
flexible.
I take this off, this is the needle. This does not stay in the patient's arm. This is all that stays in your patient's arm.
Did you get it though?
And it's just,
I know. That's
oh, it's just,
she just
now obviously this is not sterile anymore, right? So I wouldn't want to use this on a patient. But if you guys want to see it, I'm going to pass it around. I'm just going to go ahead and throw that needle away and get a new one. All right. So I like to have everything ready when I go to my patient. I like to sit here before I start, because once you start, it's hard to get the tape ready, things of that nature. Now, taping your patient up. All right, so now I'm ready to go. I've got my solution ready. I'm going to check it one last time.
Can I get a drink?
It didn't change.
Can I get a drink?
I have my little stand or something right there beside it. Tourniquet. Please bleed for me.
I always bleed good.
No, this guy doesn't. This guy doesn't always bleed good.
I need water. I'll bleed better, but give me some water. But they give me ice chips. Give me ice chips. That ain't water.
Get my cleaning solution out. Clean in to out. And you want to make it pretty wide, at least 2 inches all the way around. In to out. Don't ever go back in. All right, let that dry for a second. Get my needle out. All right, you're gonna feel a little pinch when I go to stick this needle in. Okay, so you wanna make sure you anchor your vein.
Bevel up.
And you should see a flash of blood if he's bleeding. He's really not bleeding.
See it.
Bleed, bleed, bleed.
Oh, there's a front camera.
There's a flash. There's a flash.
Got it.
Okay, now I see the flash. I do not want to proceed moving my needle anymore. I'm just going to take this and hold this in place and advance my catheter only into my patient. Now, on a real person even, you can go right here behind it, pull your needle, and it should stop them from bleeding. So as you can see, his is a little sluggish. So that's a good thing, because he's more like a person. Can you hand me the top?
Got the drip everywhere.
Yep, he's coming. He's a bleeder.
So you're going to stick that in there, screw it on, and then you're going to adjust your rate to just a slow, keep vein open. KVO is what that's called. Keep vein open just for now. I'm going to take one of my small pieces of tape and I'm going to put it right up here underneath with the tape side up, the sticky side up. And you want to slide that all the way up to there, and you're going to make like a little chevron. So you want to fold it like that, fold it like that, and then you're going to take this other little piece of tape, and it's going to go right across the catheter only.
I've never seen it done that way.
Oh, I see.
Okay? You're going to take your tourniquet off, and now you're ready to put your dressing on. Like I said, this is your window dressing here. They work really nice. So you want to take off the back side.
Oh, I like those tapes, but they hurt when you got hernia arms.
Yeah. You're going to put it, you don't want to cover where it's screwed in at. You just want to put it right there.
Yep.
Take the paper off. Some people like to leave it on so they can use it for documentation. They can write on it. Sticky until you put it on a patient.
Gotcha.
Then it's sticky. Now we're going to finish taping. Why do I have gauze? Well, if it dripped anywhere, which he did not, then I would want to wipe up any excess. Now, how do you do this? This is also, again, personal preference. I personally like to try to do like a figure 8 and tape it down. So I'm going to tape it here.
The new nurses don't be doing that. They just be having that stuff.
No,
hanging.
because they don't need to do it.
And then I'm going to put a piece of tape here. And why do I put a piece of tape up here and a piece of tape down here? Do you think?
support it.
Hold it. Yeah.
It keeps it, because if it pulls this direction, this tape is going to help remind the patient,
Right.
hey,
We got more.
you don't want to pull this. And if it pulls from up here, it's definitely not going to, it's not going to pull on that. You can also get another piece now that you've got this and you don't have any active bleeding. Now you can take your gloves off and you can put another piece of tape, like literally right here, just to kind of hold it. And this, you want to keep this open, because if I need to add another IV or if I need to add medicine, it's open for me to do so.
Okay.
And then I don't have to add it to the port up there. You only want to add like medicine up there that's a long-term medicine, like something like potassium or an antibiotic maybe, that can go in with that entire bag. But if it's like a pain medicine or something, you're going to give it right here.
Okay.
Because this is a right now medicine and it's not going to be long-term. And that's how you do it. And that's how you start an IV. And then you can adjust that and let it go. And this is where I said you would do your calculations and you would count it for 30 seconds to make sure that's how many drops you wanted to go into your patient. And that's it. Now, to take it out, nowadays I don't use the cotton balls.
Nope.
Or even a Band-Aid, really. They're going to just put tape on it because it's going to bleed a lot more than a blood draw. So you're going to want it to be a little bit stronger. So to take this out, all right, so we're going to turn it off. Remember, that's the first thing you always want to do. Turn it off. Then we're going to untape. Okay. You don't have to remove the tape. You can just stick it like that.
So you go from top to bottom, basically.
Oh, it doesn't matter. You just take it off. I just started up there because it was easiest. Okay, now you want to take this off. This is where it gets to be a little not very nice for your patient. Like I said, he can't reach up and slap me. This one either. He can't reach up and slap me either. He doesn't have the upper body strength.
We do, all right.
Honey, I'm right behind you.
All right, so I'm going to take
Just grab Miss Cashmere's hand and pull it.
one of my gauzes. I'm going to pull this. Put pressure. This is where you're going to put 2 to 3 minutes of pressure on. Up to 5, depending on your patient. So you can always have your patient, no. But you can always have your patient hold pressure too if it's in a spot where they can. Again, you're going to look at your catheter, make sure it's still intact. Mine is. Looks good. If it wasn't, you know, that's a little bit of an issue. You got to call the doctor, let them know. We don't take this off either. It just stays. But I'm throwing that away. And then piece of tape across your gauze to keep it in place. And you finished it. You're done. That's how you start an IV.